Let's talk about polycystic ovary syndrome, or PCOS. Chances are you've heard of it, maybe you have it, or you know someone who does. I mean, it affects millions of women all over the world. And honestly, for so many, it's just this really confusing and often frustrating journey.
So just how common are we talking? Well, get this. Up to 13% of women worldwide have been diagnosed with it. That's more than 1 in 10. This isn't some niche condition, it's a global health issue. And the thing is, it's way, way more complex than that simple name might suggest. And that complexity brings up a really big question. With all these different symptoms and experiences and health outcomes, is PCOS really just one thing? Can we actually treat it like a single one-size-fits-all condition? Well, some fascinating new research says probably not. We might need a much, much smarter way to look at it.
All right, so here's our game plan. First, we're going to dive into what makes PCOS such a puzzle. Then, we'll look at how scientists are using data to find brand new patterns. After that, you'll meet the 4 new subtypes they've uncovered. We'll explore why each one has a totally different health journey. And finally, we'll wrap up with what this all means for the future.
Okay, let's start with the puzzle. Why is PCOS so tough to get a handle on for both doctors and patients? Well, a big clue is right there in the name. It's a syndrome, not a single disease. And what that really means is it's a collection of symptoms, a collection that can look completely different from one person to the next.
And when I say diverse, I mean really diverse. On one hand, you've got reproductive issues, right? Things like irregular cycles and challenges with fertility. But then on the complete other end of the spectrum, you have these serious metabolic problems. We're talking insulin resistance, obesity, and a much higher risk for things like type 2 diabetes, heart disease, and even a liver condition called MASLD. With a range that wide, you can see why a one-size-fits-all treatment just doesn't cut it.
So for years, the gold standard for diagnosing PCOS has been something called the Rotterdam criteria. Basically, you need to have 2 out of 3 key symptoms. And look, it was helpful. It gave us 4 general phenotypes, or types. But the problem is, it still threw millions of women into these huge buckets, completely hiding the really important differences that affect their long-term health. It was a good first step, for sure, but it just wasn't enough. So the big question became, how do we get past these super broad categories? How do we solve this puzzle? Well, researchers turned to the one thing that can see patterns we can't: data. And a huge, groundbreaking study in Nature Medicine used machine learning to dig way, way deeper. And the scale of this research? It's pretty incredible. They looked at data from almost 12,000 women. But here's the really important part. They didn't stop there. They validated their findings across 5 different international groups of patients. Doing that ensures that what they found wasn't just some fluke in one specific population. It's robust, it's real. The tool they used is a machine learning technique called unsupervised clustering. Now that might sound complicated, but the idea is actually pretty simple. Imagine you have a giant box of Legos. Instead of telling the computer, hey, sort these by color, you just say, find the natural groups here. The computer might sort them by shape or size or how many bumps they have, revealing categories you never even thought of. And that's exactly what they did with all this patient data. They let the machine find the real underlying biological patterns. And what it found was a total breakthrough, a real aha moment. Instead of that one big messy group, or even the 4 older phenotypes, the data kept pointing to the same thing over and over again: 4 distinct, 4 stable, and 4 reproducible subtypes of PCOS.
And what's really interesting is how these groups break down. They're all surprisingly balanced, with each one making up about 1/4 of everyone with PCOS. Now, that's not just some small detail. It's a huge shift in thinking. It tells us these aren't just weird niche variations. They're probably 4 core fundamental ways the condition actually works.
All right, so let's meet these 4 new subtypes. First up, we have what they call HA-PCOS. The HA stands for Hyperandrogenic, and it's all about high levels of androgens, like testosterone. Then there's OB-PCOS. OB for obesity-related. This group has the highest BMI and, unfortunately, the most severe metabolic problems. Third is a really interesting one, SHBG-PCOS. This group has high levels of a protein called Sex Hormone-Binding Globulin, but here's the twist: they also have the lowest BMI. And finally, we have LH-PCOS, which is defined by high levels of key reproductive hormones like luteinizing hormone. Okay, but this is so much more than just slapping on some new labels, right? This is where it gets really important. Because knowing which subtype a person falls into can actually help predict their future health. We're talking about completely different journeys, impacting everything from their long-term metabolic risks to their chances of having a family.
Take a look at this. When they followed these women for about 6.5 years, the remission rates were just worlds apart. The OB-PCOS group, the one with the tough metabolic issues, actually had the highest chance of their symptoms going away over time, but the LH-PCOS group, they had the most persistent, stubborn form of the condition.
But now let's switch gears and look at the risk for type 2 diabetes. And here, the whole story flips on its head. That same OB-PCOS group had by far the highest risk. A whopping 16% of them developed diabetes during the study. And the SHBG-PCOS group, their risk was the lowest, less than 4%. I mean, it's crystal clear. These subtypes are on completely different metabolic highways.
And these metabolic differences, they absolutely have a huge impact on fertility, which, as you know, is a massive concern for so many women with PCOS. What the study found is that a woman's subtype can actually help predict her reproductive outcomes, especially when it comes to things like IVF. And the risks are really specific, and honestly, they can be life-altering. For example, the HA-PCOS group has the highest risk of second trimester pregnancy loss. The OB-PCOS group has the lowest rates of live births and the highest risk of gestational diabetes. On the flip side, the SHBG-PCOS group seems to have the best outcomes. And then you have the LH-PCOS group, who have a much greater risk of a serious IVF complication called ovarian hyperstimulation syndrome. It's incredibly specific.
And this is where the research becomes so powerful, so practical. Let's take women with that HA-PCOS subtype. For them, the type of IVF they get makes a huge difference. If they do a fresh embryo transfer, their live birth rate is lower. But if they do a frozen embryo transfer, their chances get a lot better. I mean, that right there, that's precision medicine in action. So where do we go from here? Well, this isn't just about adding a few more details to the textbook. This research could be the start of a whole new chapter in how we understand and manage PCOS. We're really talking about moving away from that one-size-fits-all diagnosis to something way more personalized. Imagine a future where a doctor can tell a patient, okay, you have PCOS, and you have the SHBG subtype, and then they can explain exactly what that means for your future health, for your fertility journey, and what the best, most effective treatment path is for you. You know, the authors of the study really said it best. They wrote, "Reliable subtypes serve as the foundation of precision medicine." And that's exactly what this is. It's not just a cool finding, it's the actual foundation for a completely new personalized future for everyone with PCOS. So, let's bring it all home. What does this really mean for the millions of women out there living with PCOS every single day? Could it be that knowing your specific subtype is the key? Could this new way of looking at things finally provide the answers, the clarity that so many have been searching for, and unlock a healthier, more predictable future? This research, well, it suggests we're closer than we have ever been.